Hello and welcome back to my session. We were talking all about gallbladder. Part 1, Part 2, Part 3 is over. Now we are on Part 4. And hopefully the final volume of the series on gallbladder. In this series, we will talk about the dreaded complication of having a condition in gallbladder which is called as a gallbladder cancer. Now, firstly, we have to realize that it takes a long time for a cancer to present itself. So, it is it should be mandatory now, at least in our country, that every susceptible person, susceptible means with a family history or any symptoms that are continuing for a long time, everyone should undergo a regular checkup once a year, which we call as health checkup. Most of the hospitals, especially the good ones, are offering very good schemes on health checks. And I feel that we should all understand the importance of a health check. It's not more than a few nights out in a restaurant, the same amount you can spend once a year in giving your body a good health check, so that you also realize what's happening inside your body. And this is precisely what I mean to say when I say that early stages of these cancers are treatable. I would not say are actually conveniently treatable, but they are treatable. While the later stage of such cancers, such as gallbladder cancers, are practically very, very difficult to treat. Hence, the mortality rate, which means that you will not stay more than for a particular time after having such a cancer, and that is very high in stages 4. And stage 1, which is limited to the gallbladder, you can remove it, treat it, and you can offer some chemotherapy, and if it is required, usually done in stage 2 metastatic when there is no other modality of treatment required. And this stage 1 can be treated very comfortably. Okay. Now, what actually causes this gallbladder, this cancer in the gallbladder? There are very simple epidemiological changes also which we can see in gallbladder cancer, whereas as compared to the northern side to the southern side of our country, northern side is seen to be having a very high incidence of gallbladder cancers. So that if we go by the statistics, about 4.1% males out of 1 lakh have this incidence, whereas 9.5% of females out of 1 lakh have this incidence in Delhi area. Whereas if you look at the Bangalore area, this incidence goes down drastically to 1.1 for every 1 lakh population and 1.7 for females for every 1 lakh population. Now, why is there so much of difference in this incidence of gallbladder cancers? There are known reasons for it. It could be due to any lower socioeconomic status. It could be due to you can have it in cases of infections prior exposure to Salmonella typhi, Helicobacter. Then it could be due to contaminated foods, stuffs like mustard oils, which are seen to be causing this higher incidence in the north. And then it could be due to industrial wastes and pollutants which are contaminating the soil. Now, maybe all this is not to the same extent in the southern parts of the country. And obviously, there's a lot of pollution going on. There's a lot of pollution, especially in Delhi area. So all these things, I don't know why the governments are not taking so much concern. Why are they not concerned about all this? Because eventually it's their money which is going to get spent into treating the health conditions all over in their states. But these are very major causes of cancers. Lung cancers we have seen so much, and then this gallbladder cancer, which is a higher incidence in states like Delhi and northern eastern states. So this is the basic reason why we are talking about that you have to identify your problem much before than it happens. And when I say, is it like very difficult to understand this problem? No. If you just go for a simple ultrasound abdomen, which is available at every nook and corner of your city, you can easily make out what is happening inside your gallbladder. So prevention is better than cure. Prevention is better than cure. So you have to understand, especially in such conditions of gallbladder, in which eventually becomes advanced stages and non-treatable stages. There is only very few % chance of survival. There's only 18, up to 18, some say 5, some say 15, higher studies up to 18% of what you see here. You can get the chances of survival, 5-year survival in case of gallbladder cancer. So what we need to do is to understand our problem. It's not that when I talked about it is asymptomatic and it is symptomatic, so you go for treatment in symptomatic, don't go for treatment in asymptomatic. This is all your call. You have to understand this, that yes, I don't have a symptom, so I don't need any treatment for that. But don't ignore this problem for years. It will take 5 to 8 years to develop, maybe less, maybe more. So this is what we have to understand again and again. That it is your health, you have to, if you can't have it done in an advanced place, then the simplest of places, get an ultrasound done. Once a year, I am sure everybody can manage that. So treat your own diseases, own problems, own diseases. Don't wait for the doctor to come and tell you this is your problem, so now you have to go for this, because most of the cases of gallbladder cancers are seen at the very latest stages. And only 25 of them are fit for surgery of the total that have been diagnosed. So we'll stop here, and just mentioning that it's not that there is not treatment, but they don't last long, these treatments. There have been certain medications that have come up, which we will talk about. You can do a genetic profiling. There are certain drugs that have come up, IDH1 inhibitors called as ivosidenib, which are used to treat gallbladder cancers recently. Then there is obviously chemotherapy, which is going on from before. And then you have surgery modalities. Now minimal invasive surgery and robotic surgeries have also helped to treat gallbladders. But ultimately you have to realize that these have to be diagnosed at the earliest stage. And once they go out of hand, it is very difficult to treat.